Hey guys, welcome back to another Women's Health Series video. Well, we are talking about birth control today. Now when I say birth control, I'm talking about combined oral contraceptives, or COCs as we like to call them, or OCPs, oral contraceptive pills, mainly those that combine estrogen and progesterone. And the reason why I wanted to make this video is because I know a lot of women feel like a lot of their providers not only push birth control on them, which I completely agree, but I also feel like we're not verbally communicating the risks to our patients. Before we begin, I just want to say that everything that I am wearing, including who styled my hair, what the name of the style is, my necklaces, my jewelry, my sweatshirt, I can't really link my sweatshirt because it's black on. Y'all know how we do over here, we support. Assuming I'm rooting for everybody that's black. Everything else that I am wearing, makeup included, fragrance, everything will be linked in the description box. You can check it there. Back to the sweatshirt, it's by this black-owned company called Corrupt Souls. I found them on TikTok shop. Well, actually, I don't think they're on TikTok shop, but I found them on TikTok. There was no delay in shipping. Customer service was amazing. I enjoyed my experience, and yes, I purchased it with my own money. So if you guys like it, make sure you hit them up and support. Now, another disclaimer before we get into this video. I want all sides to feel welcome here, okay? Whatever side of the spectrum you're on, whether you are totally fine with taking birth control pills and whether you are totally not okay with taking birth control pills, I want everybody on either side of the spectrum and everyone in between to feel welcome, okay? So one thing we don't do on this channel, on any of my channels, is we are not going to demonize women for having autonomy over their bodies and making their own personal choices like that. This is not the place for that. So if you are going to demonize somebody for taking birth control pills, if you are going to demonize somebody for not taking birth control pills, you gotta go, because you're ruining the vibes. You're ruining the vibes and you're making me mad. And I always say this, but part of being a good doctor and a good provider is welcoming all thoughts, all walks of life, all perspectives, all different treatment plans. You cannot just limit yourself to one treatment plan in medicine. If you do, I don't think that's a good doctor, because it's not up to you, it's up to the patient, right? So you have to put the patient first. So we welcome all thoughts here. We welcome everybody, and keep it cute. Keep it cute, because I don't do that. Also, I feel like this is so annoying, but we doing another disclaimer, girl. I know we hate a good disclaimer, but we're doing another disclaimer. The reason why I don't like when we judge each other is because you don't know what you will do until you've been in a situation where you were bleeding like a faucet, like a hose. Like, I have been in that situation where I have been bleeding uncontrollably. I have messed up bathrooms. I messed up my lab coat in the middle of clinic. It was so embarrassing walking out. I have soaked my scrubs being in surgery with men, all of them watching me walk out with blood on the back of my pants. It's so embarrassing. You don't know what you will do until you are going into CVS or Walgreens every 2 days, buying a new box of tampons, buying a new box of pads because you just went through your other box 2 days before. It's expensive. You don't know what you will do until you are tired, until you're messing up your bed sheets. You can't be intimate with your partner because you're bleeding all over everything. Like, you don't know what you will do until you are in an extreme of a situation. So that's why I personally do not like demonizing people for their choices, because sometimes people are just looking for relief. Like, life is so hard, especially if you're a woman, and especially if you're a black woman. I'll tell you guys more about my story at the end, because we gotta get started. First things first, I don't really like calling birth control. I prefer the term hormonal therapy. The purpose is not only to prevent pregnancy. Like, we are not walking uteri. We are not confined to our wombs. We are not walking reproductive machines. We use it to treat heavy bleeding. I will get into why. Hang on. I see you over there typing, girl. Just hang on. We can use it to help patients treat acne, use it as a coverage plan for patients who are on Accutane, even if they are not sexually active. And so that's why I don't like us referring to it as birth control. I think it has a lot of negative political implications, which is why we need to stop referring to it as that. So from here on out, I will be referring to it as hormonal therapy. Okay, so the reason why I wanted to make this video is because I feel like a lot of times when we are in the treatment process, a lot of times providers do just feel like they're just shoving hormonal therapy in our faces, which is true. A lot of providers are short on time, they have a ton of patients, and that's not an excuse, but it is the reality of just practicing medicine in this whack-ass, ghetto-ass country we in, America, okay? A lot of these providers do just say, okay, well, you just need birth control or hormonal therapy and then they send you out, and I don't think that that's the best treatment plan. I don't think that's the best way to make patients feel heard or to treat them. So it's really important to me to thoroughly explain things. So if you are a person who does not like a lot of talking, then just leave me a comment down below like, girl, this video is a little bit too long, can you make a shorter one on TikTok? And I'll make a shorter one on TikTok. But it's really important for me for people to have the rationale for all of these risks, because it's important, right? It's important in the doctor-patient relationship and in the patient decision-making process for them to have all the information. If you ain't got all the information, well, how can you make a decision, right? When doctors are short on time, they're not explaining everything. When they just want to treat and dip and get on to the next patient, they're not explaining the reasoning. I just want to make sure that women have this video as a tool and as a resource to know all of the risks that are associated that comes with oral contraceptive pills and hormonal therapy, so that you guys will have them in case your doctor is just trying to push you to the left. Because I have been there. I have been there, girl. I know what that feels like. So I do want to explain first where oral contraceptive pills put you in the menstrual cycle. Because we're giving you estrogen and progesterone, it puts you in the week before your period. So the first thing that I always tell patients if I am starting them on hormonal therapy is whatever you are feeling before your period, those symptoms will likely heighten, at least at first. They may taper off, and honestly, they may not. Migraines, fatigue, you feel like you want to eat everything in front of you. I know that's me. I'm like hungry hippo. Like I will literally eat everything before my cycle. If you get really bad bloating or if you get really anxious, those things are really important to know about yourself before starting hormonal therapy, because those will likely be heightened. So I'm gonna move from head to toe. So starting with the head, migraines. If you are a patient who has really frequent migraines, or if you have migraines with aura, meaning that while you have extreme migraines, you can see lights, you can hear certain things, you might have ringing inside of the ears, you might have extreme nausea and vomiting, you might have dizziness, that would be a contraindication to taking estrogen containing oral contraceptive pills. But if you just have migraines every now and then, you certainly can take them, but just pay attention to what your symptoms feel like whenever they come on, because that's going to be important to know before starting hormonal therapy. So sometimes oral contraceptive pills can increase your risk of having migraines because, like I tell you guys all the time in my educational videos on IG and TikTok, which if you aren't following me, like, girl, what is you doing? Come on, follow me, girl. The progesterone causes vascular relaxation, so not enough blood gets shunted to the brain. The brain can have a little bit of ischemia or decreased blood flow, and what will happen is inflammatory markers will get secreted. So that's why you can have migraines. You can also have an increase in your mood disorders, mainly anxiety. Estrogen tends to stimulate the thyroid gland. You can have increased total thyroid hormone that is circulating inside of the system, and so sometimes that can make you feel really anxious, really jittery. So if you do feel this way when you're starting hormonal therapy, it is not just your mind. You certainly can have that as a side effect. Also, you can have fatigue. In the window of your menstrual cycle where hormonal therapy is going to put you, it's basically trying to trick your body into thinking that you're already pregnant. So whenever you're pregnant, your body is going to prioritize growing the pregnancy. So all of your nutrients tend to flow to the uterus and the ovary. Your body is not prioritizing blood flow to your brain, it's prioritizing blood flow to your ovaries and your uterus, and so you can of course have fatigue. Now this isn't a risk that's exclusive to all combined oral contraceptive pills, but mainly those that contain first or second generation progesterones, which have extremely high androgenic activity or activity that's similar to the male hormones like testosterone or DHT, dihydrotestosterone. Those progesterones can act at the level of the skin. It can stimulate the pilosebaceous units, or the unit inside of the skin that contains the hair, and the sebaceous unit which secretes oil onto the skin. The progesterone can stimulate those units and you can have an increased risk of acne. Now typically with continued use this should better itself, but this is one of the reasons why I myself tend to use a third or fourth generation progesterone, and I'll list those on the screen. A favorite is Yaz. It contains a third generation progesterone just so that it doesn't have as much androgenic activity, so you don't have that increased risk of acne forming. Moving on to the chi-chis, just kidding, the boobs. The breasts. Progesterone causes maturation and differentiation of your breast tissue, which is probably why you might have a lot of breast fullness and breast tenderness right before your cycle. So this is also another increased risk with oral contraceptives. Both estrogen and progesterone work at the level of the breast to grow, stimulate, and develop the mammary glands. So there is a slightly increased risk of breast cancer. Now, I cannot put enough emphasis on slightly increased risk with prolonged use. The risk is like less than 2%. I do not think that this risk is significant enough on a large scale where we need to just discontinue use across the board and everybody. It is a slight risk, okay? This is not something that you're going to develop next year if you start taking birth control pills. Moving a little bit deeper to the heart, remember I told you guys that combined estrogen and progesterone therapy puts you in the window of your menstrual cycle where it thinks you're pregnant. So in order to get all that blood flow to the uterus, the body is going to secrete hormones and modulators that force your heart to work a little bit harder to pump blood to those distal places. So in some patients, and very rarely this happens, it can increase your blood pressure very slightly. Now, once again, this is a very slight and minimal risk. It usually only raises your blood pressure about 3 to 5 millimeters of mercury, which is very minimal. So if you are someone who is young and healthy, I do not think that this risk is clinically significant. So let's say you go to the doctor and your blood pressure is usually 110 over 70, then it might be anywhere from 113 to 115 over 70. Again, not clinically significant. This is why we're a little bit hesitant as well to use it in patients who already have chronic hypertension or high blood pressure, or in those patients who are a little bit more elevated in age, because as we age, our risk for chronic hypertension is elevated. Also, just can we take a second? Like, I'm not trying to scare anybody. Once again, I'm just trying to make sure you guys have the information so that if you feel like you've been rushed through, my bra showing. Sorry. If you feel like you've been rushed through, not everything was explained to you, I don't want you feeling like that. So I'm telling you about pretty much every single risk that can occur. I'm not trying to scare you. So getting back into the video, play the rewind music thingy. Because those modulators and pathways are stimulating your heart to work a little bit harder, you can have a very minimal increased risk of myocardial infarction, or in other words, MI or heart attacks, as well as stroke. Once again, this risk is so minimally elevated, it's almost not worth mentioning, but again, some people want to know that, and I know I would want to know that, so that's why I'm saying it. Moving on to the belly. Moving on to the belly. Progesterone also causes the relaxation of the muscle in your stomach and intestines and your colon. So because your stomach isn't going to be contracting a lot to push the foodstuffs into the small intestine, sometimes food can get backed up and you can feel really nauseous. That nausea can also be a sequela of the increased amount of fluid that's inside of the brain that comes with those hormonal changes. So yeah, you can have nausea. Estrogen does stimulate your liver, so there's two main things that I want to talk about here. Number one, with extremely prolonged use and in very rare situations, you can have the formation of benign liver tumors. And there's mainly two that can form: hepatocellular adenoma and FNH, or focal nodular hyperplasia. Does this happen frequently across the board? No. It is a very minimal and rare risk with prolonged use. But also, your liver is actually where your body makes coagulation factors. Those are the proteins that are secreted inside of the blood to help you clot if you get a cut or if you're bleeding too much. So estrogen stimulates that pathway. So you can have an increased risk of what we call VTE, or venous thromboembolism, at the level of the lungs or in the peripheral vasculature, mainly in the lower extremities. Just because of the forces of gravity and your own body weight, blood tends to pool inside of the lower extremities. Once again, it's not that significant of a risk, but it is something that all providers should be telling their patients about. There's no scientific evidence that shows that combined hormonal therapy will contribute to weight gain. However, where the hormones are increased inside of the menstrual cycle, it can certainly stimulate your brain to want to eat more. So if you eat more, because I know I would, I love eating, okay? You most likely will gain weight. So that is the reason why a lot of patients do experience weight gain, is because of the progesterone stimulating the medulla oblongata. Don't I sound smart? Yeah. We're gonna move a little bit lower. Now we are in the region of the pelvis. So we've got our female anatomy there. So let's move externally to internally. Because of the progesterone component, remember I said earlier, especially the first and second generation progesterones, those will cause an increase in your androgenic activity, and they can function like testosterone and DHT, dihydrotestosterone. Those are going to stimulate your external female anatomy, meaning it's going to have some increased blood flow, increased signaling towards the brain, and increase your libido. So I guess that could be a beneficial side effect. baby. But also in that same token, remember earlier I said that you can have a lot of fatigue in this region as well. So you might have a lot of decreased libido as well. Sometimes when you're growing pregnancy related tissue, remember I told you OCPs are trying to trick your body into pretending it's pregnant. When you're growing things, you're not worried about self-pleasure, right? So it is expected to have low libido as well. Moving internally, and this one is going to be a little bit hard to explain, so just try and go with me a little bit here. You can have unscheduled bleeding, usually within like the first 1 to 2 weeks of starting your hormonal therapy. So how your body determines that it's going to have a period or it's going to bleed is if your hormone levels drop. So in a lot of patients who are starting OCPs, they typically are getting on it because their hormone levels are already too high. And even though we're giving you an exogenous or an external source of estrogen and progesterone, you would think that we're going to heighten those even more, but that's not how the human body works, especially the menstrual cycle. The body incorporates something called negative feedback mechanisms. So if you are producing too much of something or if you are receiving too much of something, your body is going to produce less of it. So in patients who have really high estrogen, those would be patients who have fibroids, endometriosis, adenomyosis, extremely heavy periods, and in people with extremely high levels of progesterone, those would be the sisters, PCOS patients. If we're giving you the external sources, your body is going to start producing less of your estrogen and progesterone, which is why it can be beneficial in some patients. Because those levels are dropping a little bit, your body is going to signal that as, oh, well, we need to bleed, we need to have a period. So you can have a little bit of spotting and unscheduled bleeding. Typically with continued use, this usually tends to resolve around 3 months, and sometimes we might have to give you a little bit extra hormone just to bring your levels back up so that your body will stop the bleeding and so that we can reset your lining as well. So if you do have this, a quick phone call to your OBGYN should be able to fix that. Sorry, y'all, my lashes is drooping a little bit. I hope they're not drooping on camera. So moving down to the level of the cervix and the vagina, there has been shown to be an increased risk of chlamydia as well as HPV. Now, I'm gonna stop you right there. Okay. The reason for this is a confounding factor. The reason why you see increased cases of chlamydia in these patients is because when patients are starting hormonal therapy, they say to themselves, oh, well, I am already on a birth control method, so I don't need to protect myself during intercourse. So typically patients who are on OCPs are not protecting themselves during intercourse. We see it all the time at our well woman exams when we're asking our patients these questions. So it's not that the hormonal therapy itself is causing the increased risk of STIs. It's the behavior whenever these patients are on such medications. I hope that makes sense. The big phrase that's going around right now, which thank God it is, correlation is not causation. Something like that, girl. But it's true. And let's be very clear, HPV is an STI. And HPV is responsible for the overwhelming majority of cervical cancer cases. Cervical cancer grows very slowly. So in patients who utilize OCPs for a prolonged period of time, and they also are engaging in risky sexual behavior, aka not using condoms or barrier methods, then they themselves can have an increased risk of cervical cancer. Once again, not caused by the OCPs, but the behavior associated when patients are taking OCPs. Surprisingly, we don't see increased risks of pelvic inflammatory disease, gonorrhea, trichomonas, and that's because women who tend to be on OCPs tend to need refills, so they attend their well woman exams more often, and so they're testing for these things at their well woman exams, so they actually experience lower risks of everything else. Is that everything? I think that's everything, girl. Now, if you're over the age of 35, if you already have high blood pressure, if you have migraines with aura, if you are a person who smokes, if you are a person who has a personal history of blood clots or VTE, or a family history of blood clots or VTE, you might not be the ideal patient to take OCPs. Once again, I know that this seems like a lot. It's like, well, girl, is there any benefit to taking OCPs? Like, why would I even take this? I know some people don't want to hear this. I do not believe in demonizing female hormones. There's a lot of benefits that estrogen can have on your heart. It is protective of all-cause mortality until you are 65. It makes you pretty. Skin be glowing, skin be plump, skin be flushed. I mean, who's gonna complain about that? If you're gonna complain about that, you gotta go. Because as you see, we like appearances over here. The biggest benefit is not experiencing pregnancy or delaying pregnancy until you yourself are ready to enter into that stage of your life. Pregnancy is expensive, okay? In time and in energy. We know how these men out here are, okay? And we know how this administration is, okay? So that's the biggest benefit. Also with prolonged use, they can decrease your risk of endometrial and ovarian cancers, and that's because your body is tricking you into thinking that you're pregnant, right? So you don't have as much proliferation at the level of the endometrial lining inside of the uterus, and you don't have as much proliferation and functioning of the ovary. So that is why you can have a decreased risk in those cancers. It can help patients with their acne. Like I said, it can worsen it whenever you're first starting it. Sorry, y'all, I ain't good with strapless bras. My tits is heavy. Shit. I hate that feeling. It actually decreases your LDL, which is the bad cholesterol, and it increases your good cholesterol, which is HDL. Another reason is in patients with extremely high bleeding profiles. I have seen it for myself. It helps a lot of women. There are risks to continuing to have heavy bleeding. You're spilling out all of that blood, you're losing a lot of iron, and you're increasing your risk for fatigue, decreased functioning in your ADLs or activities of daily living, and your heart has to work harder at pumping blood to your peripheral tissues. So heavy bleeding and iron deficiency anemia for an extended period of time is a risk of heart failure. Now, I myself had an endometrial polyp several years ago, and when I tell you it was like a faucet, baby, actually, F that, not even a faucet, it was a garden hose. Actually, it was Niagara Falls. Did y'all catch that vlog? Did y'all see that? It was Niagara Falls over here. So I took OCPs. It was not for me. I did not enjoy the experience. I had extreme headaches, extreme migraines, extreme nausea on it. Girl, half my face went numb. I'm pretty sure I had a TIA. It's not for me. It did not work for me. I got my IUD though. That's helping a lot, thank God. It was horrible the first 6 months I used it, but we just talking like girlfriends now. But no, like my IUD saved my life. Sometimes, like I said, life is hard. People are in transition between marriages and relationships and in jobs, and they have a lot going on with their kids, or people just have a lot going on, and that's totally okay. In this season of your life, you might need a little bit of help. That is okay. And we shouldn't be demonizing people because they need help. And honestly, especially in this world, do y'all realize how much estrogens are around y'all and all this daggone plastic? When I was making the outline to this video, I was looking around my room and I was like, there is so much plastic in here. Like, my fan is made of plastic. That shit is made of plastic. The rims on my lights, plastic. The cord to my charger, plastic. The tripod that this camera is sitting on, plastic. This camera itself, plastic. This TV, plastic. Half of this jewelry from Amazon, plastic. This hair, plastic. So there's so much plastics and microestrogens around us that we're just exposed to so much nowadays, and sometimes people just need help. I tell patients, typically if I'm starting them on OCPs, an indication of heavy bleeding, I tell them you don't have to be on this for an extended period of time. While you're on these pills, we can do other measures to increase your iron stores, figure out other lifestyle measures and other conservative therapies that can help you decrease your bleeding. Now, the same way that there's a lot of benefits, there's a lot of risks as well. Like I said, the majority, like 99% of the risks that I mentioned are very minimal and slightly elevated risks. It's up to you to determine what is best for you, not me, not anybody else. The one place where I feel like providers can get a little bit better whenever we're prescribing OCPs is letting patients know that it doesn't have to be a permanent treatment plan. It can very much so be a temporary relief so that you can incorporate other lifestyle measures to contribute to your complete and holistic healing. For example, in patients when I am starting them on OCPs for an indication of heavy bleeding, saying, hey, you don't need to be on this for an extended period of time, but I think we should at least be on it for 3 months so that we can build up your iron stores. It takes 3 months for your iron stores to increase. Here's some other conservative measures that we can incorporate so that we can increase your iron, like doing blackstrap molasses, decreasing your exogenous sources of estrogen, so like soy, trying to drink out of glass water bottles, examining all of your beauty ingredients, hair, skin, makeup, perfumes for any estrogen modulating ingredients, so like phthalates, parabens, and decreasing that as much as possible, decreasing the amount of plastics that you use as much as possible, decreasing your intake of red meat, dairy sources. All of those things contribute to your heavy bleeding. So while we are on this therapy to help save your life, essentially, let's also incorporate these other conservative measures to build up your iron stores and get you healthy again. So in another 3 months, we can maybe try a non-hormonal method. Now, there are other non-hormonal methods to doing this, but those also come with their own set of risks as well. But ultimately, you have to do what is best for you. Once again, I hope that everybody is just going to be open-minded with this video and just welcome everybody's story and everybody's walks of life. I want you guys to share your stories down below. I just don't want anybody demonizing women for needing help. Like, that's not fair. That's not fair. That's not fair. It didn't work for me. I didn't like it, but that doesn't mean it can't work for you, and that doesn't mean that you can't have a different story. And I ultimately think that that's what makes someone a good provider, is that they realize that just because something doesn't work for them doesn't mean it can't work for somebody else. But again, I feel like everybody should be told the risks. At the end of the day, we're human beings, and I feel like you should treat people the way that you want to be treated. And so I feel like you guys should have the risks at your fingertips. Once again, I'm a little nervous to upload this video because I know it's very sensitive, and I know that I just don't want to scare anybody, but I also just know I'm opening the floodgates for a discussion that I hope everybody can have it in a respectful manner. So yeah, that's it. I hope this video helps someone. Leave your questions, comments, and stories down below. I would love to hear them. And yeah, till next time. By the way, the vlogs will resume. Just FYI, my mom got sick. She's doing better. She's on the mend, but she had a lot going on, and obviously I am her power of attorney. So I've been dealing with a lot of phone calls and appointments and driving her everywhere and dropping everything at the what is the phrase? Dropping everything at the sound of a hat or sound of a dime, something like that. Girl, I be dropping everything to be there for this lady. So I apologize. The vlogs will resume very shortly, and until then, I will see you in the next video. Am I creasing? My lash. Doesn't my makeup look good? Inside of the brain. So it's totally okay if you do experience low libido. A beetle? What's a beetle doing up in there, girl?